DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to the show. Thanks for joining us. Today's going to be a fun one. We're going to be in a clinical skills simulator at Iowa State University's College of Veterinary Medicine with Dr. Frank Cerfogli. They're going to show you a lot of different things today about how vet students are learning how to do suture patterns and put in IVs. I hope you enjoy it.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, here we are in the Clinical Skills Laboratory. Dr. Frank Cerfogli is a veterinarian that teaches here at Iowa State University, teaches veterinary students first, second, third year here in the clinical skills.
Yes, even fourth year.
And even fourth year. And another person that went to veterinary school with me and has sworn to secrecy on both counts. Now, what we're going to go through is talk a little bit about some of the clinical skills that you teach, because this is just amazing. I wish they would have had this when we went through veterinary school.
This seriously is, new to Iowa State in the past year. We started January of 2016, and I maybe had 30 students walk in the door January, and now, 8 months, 9 months, 10 months into it, I'll have 240 to 410 students walk through the door on a monthly basis to come in and do skills.
So it's kind of like a way to learn how to be a veterinarian and do this without maybe some of the negative implications of whether it's caseload or doing it on an animal that in a research setting.
Correct. And this current setting, I have no animals, just simulations. And also in this setting, I have no grades. The students come down, they are asked to do the skill. I can be a dove some days, I can be a hawk others. And on particular skill, whatever it is, make sure that they don't leave until they've gotten it, or they keep coming back until it's accomplished.
I liken it to someone that's in a basketball player or something. You need a place to work out, a place to lift weights, a place to shoot baskets, and things to that nature, right?
Yeah,
and veterinarians probably ought to have those, not just learn it from a book.
Yes, the skills gym.
This is the skills gym.
I might put the sign up now.
All right,
Yeah.
let's do it.
Well,
let's see what you got here.
First thing that we do now for first year students, we kind of did this approaching second year labs, but now we're doing knot tying boards for the first year students. The students come in. I'm sorry I don't have any Kansas State ones here, but I got a whole lot of ISU Cardinal and Gold.
I'm alumni. I'm fine with the Cardinal Gold.
So we'll teach those students what the difference is when they get these knots thrown, or whether they're throwing good square knots or whether they're throwing granny knots. And then I can show them how one knot is superior to the next. A lot of students come in here and they're tying high. Well, when they tie high, they leave a strand high. As they tighten it, that's going to be a slip knot. They're going to have both of these strands parallel to the table in order to get a good square knot in.
That's awesome.
We also have placed in the first year student's hand a needle holder and then a paracord, which is our first year suture. And then we're showing the students how to come in here and go around a pedicle to ligate an artery or vein. And that they're going to have confidence now that I can't get this apart when they're doing it, that they'll have the same product in the animal.
Wow. So you're able, the first year basically is some skills on suturing, knot tying, and ligating.
Correct.
And then you also ran me through the palpation, where these are where they have puzzles and Legos and things, and you learn how to put them, and it gets you to start having that dexterity then of not being able to see and how to get it done.
That's correct.
So let's take a break. While we take the break, while y'all are at commercial, we're going to move from the first year to the second year of veterinary school. It takes a little bit longer in real life, but Dr. Frank Cerfogli is here with us. Thanks for joining us.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Peter Strasberg was recently awarded an Amstutz Scholarship. Growing up in Wisconsin, he spent a lot of time on a relative's dairy, and from then on, Peter has worked in one aspect or another of the dairy industry. His interests include reproductive physiology, cattle comfort, and herd level management. After graduation, Peter hopes to join a predominantly dairy cattle practice.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
The new Better Horses Network is worldwide. Presented by Lucas Oil. Featuring worldwide radio and TV with iconic hosts like Al Dunning, Sharon Camarillo, Ernie Rodina, Lindy Birch, and Craig Cameron. With American Cowboy, Horse and Rider, Brushy Creek, Cavenders, and Ride TV. Worldwide radio and TV. The all-new Better Horses Network.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Folks, welcome back to the show. Thanks for watching us today. Dr. Frank Cerfogli here at Iowa State University. We're in the clinical skills lab that he runs here, and this is just amazing. If they'd have had this when we were in vet school, right?
Me too, exactly.
Geez Louise, this is something else. So this is the second year lab. So kind of walk me through some of the different things that you have here and that you're able to simulate for the veterinary students.
Well, initially what students did a lot of times when they wanted to learn how to suture is they went to the refrigerator and got the rotten banana and a rotten orange. And now, today, all the different levels of synthetics that they make, whether it's urethane or silicone, we can produce a model that is very realistic and has all layers. So as we cut through this of course came intact. As we cut through this skin, we have all layers. We'll have skin, we'll have a sub-Q layer, and we'll have this very dense connective tissue. And if you're in the midline of the abdomen, this is where you first learn of this external rectus sheath, or linea alba. This is a very nice area of distinct anatomy that you want to focus on, so that you're always going into the abdomen and an appropriate approach. Well, now the student has done that, and they can also close. So now they're going to close up these three layers on this particular model. They're going to close the external rectus sheath, or linea alba. They're going to close the sub-Q, and then they're going to close the skin, have an appropriate closure. So we have different colors, different textures. There's 3-layer, there's 5-layer. There's even some that will bleed. So as we go through them, there's a company with what they refer to as real flow technology, and they will some of these models will bleed. But We also have internal organs besides skin, right? And then
Yep.
we're in there doing an abdominal exploratory and we decide we need to open the bladder or need to open the uterus or open the stomach and intestine. And then these are all various versions of that. So we have a model that's mostly urethane rubber. We have silicone rubber. We have foam. That's probably the first type out, right?
Yep, so kind of get started and they practice on that and then move to this, but this is amazing.
It's very realistic, and as you open it up,
feels real.
It has a real feel, real look. Believe it or not, one thing that I use to make it even more realistic is baby powder or talcum powder, and that makes it slippery. So you wouldn't think that it would, but it relieves all of that tackiness, and it makes this particular organ and this model in particular slippery, just as the real deal.
So you have different incisions here. You have resection and anastomosis.
Sure. So we have a resection and anastomosis. This is where we're going to take two pieces end on, and maybe we've removed them. And
so sometimes when you go in and you take out a piece of intestine and then you have to reconnect.
Sure. So this is an anastomosis end to end, whereas this type, maybe we just had to take out a tennis ball or a golf ball, whatever that dog had
super ball.
Yeah, they woofed it down, and now now it's my responsibility. And then this would be something that we refer to as a gastrotomy or enterotomy.
Awesome. You even have the one here where you've done the Utrecht pattern like a uterus if
Sure.
you're doing a C-section.
Sure. If they wanted to pretend this was the bladder, it's the bladder. If they wanted to pretend it's the stomach, it's the stomach. And these are homemade versions that I've just come up with here. And if they wanted to close the uterus, this is the Utrecht pattern for the closure of a uterus.
All right. Well, folks, we've made it through the second year. We're headed to the third year. Thanks for watching Doc Talk. Dr. Dan Thompson, Dr. Frank Cerfogli. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello, Dr. Nels Lindberg here with Production Animal Consultation and Animal Medical Center out of Great Bend, Kansas. Today's BQA Tip of the Day, we're thinking about the holidays. And everybody wants some time off for the holidays, but we still have animals to feed and take care of. And so going forward with the holidays coming up, think about how you're going to manage your people and manage their time off. Number one goal is we want our people to be able to be with their families, especially if they're millennials or anybody, I would say. They really want to spend time with their family. So how do we set up our schedule so that we can take care of our cattle and take care of our people? Again, if we don't prepare for it up front, we could create some issues on the back end, whether it's with our team member or with the animals that we haven't properly scheduled people for to take care of. We must do it, we must attack it early. So think about those schedules. How can you work with your people so that they can be with their family? That's priority number one. And then number two, at the end of the day, we still have to take care of our cattle. Give those things some thoughts and keep at it. Thank you much.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Folks, welcome back to Doc Talk. Dr. Dan Thompson with Dr. Frank Cerfogli. We're in the Clinical Skills Laboratory at Iowa State University's College of Veterinary Medicine, where Dr. Cerfogli teaches students on a day-to-day basis these clinical skills using models, which is just phenomenal.
They're very realistic.
My gosh.
There are low fidelity models, as they say, and high fidelity models, and we're trying to get more and more high fidelity models as long as they're reasonable. This one in particular is a canine catheterization model. We have a vein here that you can see. It's clear, transparent, and then the canine limb is darker. But as the student can now actually feel this without skin. I take it to the next step and I put the skin on, and it's still there, and underneath there they can be able to isolate that vein. They could cut down to it if they needed to, or they can place the catheter in it with the skin on, just as if it would have that feeling or palpation in a real dog.
There's a few people who have taken my blood that could have used this model in practice
Sure.
instead of practicing on me. All right, so we have these models, and then this is unbelievable.
This is an abdominal exploratory model, and this is third year. We're teaching the students how to put in the IV catheter, therefore they would be able to deliver the animal's anesthesia. And then building on that, besides the anesthesia and placing them under general anesthesia, we're going to actually do the full surgery, and in particular in dogs and cats, tried and true procedure for all veterinarians to have to learn as a day one skill is the ovariohysterectomy. So the hysterectomy,
how to spay a dog.
Removal of that uterus and the ovaries in the dog and cat. Sometimes that's very beneficial. Your cat's not bothering you every month, all throughout summer.
Exactly.
And the dog's twice a year. They're
Or
just going to stop.
kittens.
Oh yeah, they're just going to stop cycling. So this is a particular model. It's a fairly high fidelity. It's all silicone, but I have an abdomen with a skin, and again, those real layers of skin that I go through. We have an omentum, an intestine. I have a bladder. I have kidneys, spleen, and then in here I can teach the student as they go through this body wall and they feel for things that we're looking for to identify where the ovaries are in the animal, where the uterus is in the animal. And then in this particular one, this student can actually do the surgery and take out a completely synthetic silicone uterus and ovaries. This is the insert, so it of course looks a little bit different than it's in the model, but we have the ligaments necessary to break down.
Yep.
And we have all artery, a red piece of thread here in there to simulate that artery and vein. And then how I can tell, I can tell that the student did it successful, that all the components have been removed. I can go back in and I can inspect that they did a double ligation on this artery and vein, that they did a double ligation on this artery and vein, and then they also have done that for the uterine body.
Absolutely incredible. Lots of different things. Can't imagine what it's going to be like in 10 years.
I think they're going to have 3D print the dog.
Well, folks, we're going to take a break. We're going to come back with our wrap up here in the Clinical Skills Lab with Dr. Frank Cerfogli here at Iowa State University. Thanks for joining us. More to come.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
I'm Joe Mushrush with Mushrush Red Angus, and my ancestors have been in this part of the world. Well, they walked in after the Civil War from Virginia. My dad was the start of Mushrush Red Angus. When we come back from college, we had about 100 cows, was working mainly part-time. My wife Connie and I, once we took over, tried to expand rapidly, making it into a full-time operation. We have told our kids that any of them that wish to return to the ranch, why we would do our level best to make a spot for them. And so far, our oldest son, Daniel, is now back full-time with us, and some of the others have expressed a desire to return, and so we have dedicated most of what we do into creating a spot and making a viable entity for anybody that wants to come back.
In an effort to get more of our family back on the business, we've started our own meat company. And so when we can take, say, a flat iron or a petite tender, and our local packing house has the knowledge and the ability to turn that into a higher retail cut, we'll sell those retail cuts quicker, and we'll sell them for 3 to 4 times the price of what we would sell them without some of those cuts being available to us.
The beef checkoff allows us to do something that we can't do on our own. We do not have the time or resources or the knowledge to go out and approach consumers on our own. By pooling our resources with other producers, it allows us to reach those consumers that we otherwise would not have any way to reach. And by combining our resources and our voice, why, hopefully we can make a difference.
And I hope one day that my children will be here on the ranch. So we need to be able to be responsive to the demands of future generations that we may not even be aware of, and the checkoff helps our industry do that.
Horn flies are a nuisance and a production loss, so getting rid of the problem is important. What I like about the Vet Gun is you don't have to go out there weekly to treat them with a topical fly applicant. It has some duration, it lasts. You see the increase in weight gain, it just works. I've used it on our 1,500 cow-calf operation, and it makes me more confident in saying, hey, this product's gonna work on your operation too.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here with my friend and colleague, Dr. Frank Cerfogli. We're at Iowa State University in the Clinical Skills Laboratory, which is just a phenomenal laboratory and an environment for teaching future veterinarians. And what in the heck?
This is Petunia.
We have
This is Petunia, and she happens to be a model created to help students learn how to do jugular venipuncture, draw blood on alpacas.
I could have used
camels, llamas, all the above. The anatomy is going to be very similar, but of course this reduces the student anxiety, and this model and all the other models that I showed you today are a component of helping students learn in a stress-free environment, and that there's no grades attached, and then a lot more learning, I feel, happens.
And there's no client breathing over the top of you. It's an opportunity to really learn and gain confidence.
Oh yes, I encourage mistakes, right?
Yeah.
So it's like, let's fail as many times as we can today so that when it counts, we get it right.
Yeah, well, just in general, I mean, the philosophy, what do you see in the students when they come in here? And I mean, they've got to be excited.
I think the students are excited. I think clinicians are excited. I think the clinicians all the time come to me with crazy ideas. Let's build the next model. Let's make the next simulation, because they want to add something for their students in this particular laboratory.
So it's something they have in their hands before they get to the clinics?
Oh, some of it, yeah. Some of it is definitely preparatory for when they have them as a student or for their next class.
Now, this doesn't just happen for free. This is something that obviously with the amount of equipment, and you say you got more coming?
Yes, we have euthanasia simulators, we have a full colic simulator, we have a bovine therio. I know you saw Frosty today and you've done some calf simulations of your own with your own equipment, but we're gonna have a full bovine therio unit that has a palpation in it, that has a 45-day, 60-day, 90-day pregnancy along with an open heifer and an open calf.
All of this within simulation, and to be able to just teach and have open opportunities. You know, folks, this is an opportunity that Iowa State University has seized, that they're moving forward in veterinary medicine Dr. Slining, Dr. Cerfogli are helping push this type of initiative forward. They say that there's a fundraising arm going on now.
Correct. So Iowa State as a whole has a fundraising campaign for foundation, and then the College of Veterinary Medicine makes their own individual goals as well. And then some of those goals in particular are going to be to help out the Clinical Skills Lab.
So if you feel the need to step up and you want to help future veterinarians, check with Iowa State and see. I'm sure that they would take a donation towards the Clinical Skills Laboratory.
I definitely have projects in mind.
Well, thanks for spending time with us today. Thank you for watching DocTalk. Remember, always work with your local veterinarian. And if you want to know more about what we do on the show, you can find us at www.doctalktv.com. I'm Dr. Dan Thompson with Dr. Frank Cerfogli. We're from Iowa State University, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.